The third of these key solutions has to do with managing pricing and communicating value so that our clients don't walk away sticker shocked. This slide shows another piece of the study that demonstrates the areas that pet owners thought were strengths in veterinary practices as opposed to areas that they thought were weaknesses. It was very clear that pet owners liked the fact that their veterinarian was friendly. They thought the staff was friendly at their veterinary practices. They appreciated the range of services. All those things were considered strengths in their visits to veterinary practices. A couple of other areas that they considered strengths, although they didn't think were as well done as the friendliness and the range of services, had to do with the method with which reminders were sent, the hours of operations, and the fact that their pets were seen on time. When we look at the areas that pet owners were less satisfied, the first of those includes the comfort of the reception area. And clearly, many pet owners felt that the reception areas of the veterinary practices that they visit were not a comfortable place to spend time. That's an easy one for us to fix. And every manager, every owner ought to spend a half an hour nonstop in their reception area and take in the smell, the comfort of the seats, the noise level, whether there's coffee available, but sit there and think, what would it take for me to be happy sitting here for a half an hour? When we look at the areas that pet owners felt were the more significant weaknesses in veterinary practices, we find two. The first has to do with value. So simply, did the pet owner perceive that they got as much value from the visit as the price would have them believe? And pet owners really didn't end up thinking that. They really felt that for the price that they paid, there was not nearly as much value as they would have expected. The second area that pet owners considered to be a weakness had to do with payment options. So it wasn't necessarily the absolute price or even the value, but it was how they were expected to pay for the services. As we talked about earlier, we've seen some really significant fee increases in veterinary medicine since 2004. About 3/4 of fees have increased above the rate of inflation from 2004 to 2006. 2/3 of anesthesia fees increased 11 to 24% above inflation. Inflation was about 6% for that 2-year period, so that really means these fees increased 17 to 30%. About 72% of treatment procedures increased 6 to 22% above the rate of inflation, and surgery fees saw some of the biggest increases. Those increased anywhere from 8 to 54% above the rate of inflation. The rate of fee increases slowed from 2006 to 2010. But what's important to remember is that fees didn't go down, and it's not that fees remained flat. Simply, they didn't go up as much as they had previously. And what we found in this study is that price is an issue. It was not only the absolute price or the absolute cost of a veterinary visit, but the escalation. I mentioned earlier the pet owner in one of the focus groups who said all of a sudden the price just skyrocketed. You could go and it was $60, now I can't get out for less than $150. This woman clearly has been noticing that veterinary fees have gone up dramatically. There's another really interesting point out of this statement. What we don't know about this pet owner is whether she got a different bucket of services for her $60 than she got for her $150. It would appear from here that whether or not she did get more services, she doesn't perceive it. All she sees is that the price has gone up, but she doesn't see that her pet got better care. And either her pet didn't get better care and the price just went up, or the pet did get better care, but we didn't communicate it to her. So one way or the other, there are things that we need to change. It's also important to understand that pricing is not a standalone business strategy. We simply can't use pricing as the only way to improve our earnings or improve our profitability. One of the veterinarians in the veterinary focus group said, my business dropped by 20% last year, so I raised my prices by 20%. Obviously, that's not sustainable, and of course, we're punishing the people that are most loyal to our practice by saying, because other clients went away, you have to make up the difference. It's clear that there's no one-size-fits-all approach to pricing. We can't simply say in the future that we're going to take our fees and increase them 5%, 10%, 15%, whatever it's been. These large annual across-the-board fee increases are simply not going to be sustainable in the future. So pricing approaches have to be based on practice niche, the value you offer, what your competitive strategy is in the market. it would be very, very difficult to say, here's a pricing strategy that will work for everyone. And in fact, some practices may not need to change their pricing strategy. If you have a practice that is highly profitable and that is seeing real growth, so real growth in clients, real growth in number of pet visits, real growth in the number of services that the pets that come to your practice are receiving, you may not need to change your pricing strategy. But if you are losing clients, if you have declining visits, if pets aren't getting as much care as they used to, if you are not a profitable practice, you simply have to look at your hospital and say, to what extent are my pricing strategies holding me back? I think it's important to remember that there's actually several components of this price issue. One is the absolute dollars that we charge for a particular service. The second one is the value. And so do clients perceive that this is a service or a product that they absolutely must have for the health of their pet? The third has to do with financing alternatives. You may have a client that is comfortable with the absolute dollars that are being charged for a particular service, and they are fully convinced of the value of that service. But if they have $300 in their checking account and a maxed out credit card, it doesn't matter if they are okay with the price and okay with the value. They simply can't pay for it. And that means we have to help clients understand what kind of financing alternatives are available. A couple of strategies that came out of this research. Not all of these strategies were tested with the pet owners in this survey, but they were a natural outgrowth of some of the things that pet owners were saying. The first strategy was actually tested in the research, and we asked pet owners what they felt about the concept of a routine care plan that included a certain bucket of wellness services that would be billed to them on a monthly basis throughout the year. This bucket of services, there could be certain levels of the bucket of services, so a basic level, an intermediate level. Generally, it's going to include wellness type or routine type care, so vaccinations, spay, neuter, dental care, that sort of thing. Very similar plan to the type that Banfield offers now, and there are some practices who are not Banfield practices who also offer this type of wellness plan. That was rated very highly by pet owners. They seemed to like a couple of things about it. One is the fact is they knew what kind of care would be good for their pet during the year, but the second was they could budget for it. They had an idea of what it was going to cost to provide basic wellness care to their pet. Obviously, this kind of a plan isn't going to include illnesses or accidents, but at least for the routine stuff that most pets need during a year, they could budget for it and they knew what to expect. When we start to look at other strategies, we can draw some information from pricing strategies from other fields. One of the things that we could look at is targeted incentives for clients we haven't seen in a while. So we may say, here's a whole group of cats that have not visited the veterinary practice in 2 years. Let's do a promotion where we try and get those cats back in, and maybe we'll cut the cost of our exam fee by 50%. Hopefully we bring those cats back into the practice, we do a better job of educating their owners about the need for veterinary care, and they become better clients than they were in the past. I think the issue of exam fees is a really interesting one. In the Banfield wellness plans, no exam fee is charged when a pet comes in to the hospital. This makes it very easy for pet owners to say, I'm worried because Fluffy is scratching her ears, or Fluffy is limping, or Fluffy's rubbing at her eyes, or whatever it is, and to bring their pet in and not say, geez, it's going to cost me at least $60. Now they can come in, the veterinarian can take a look at whatever's bothering the pet, can talk to the owner about what kind of care is needed. Very often that owner is going to accept the care. The veterinary practice still makes money off of the transaction. They don't make it on the exam, but to the extent that the pet owner buys more services, if you will, and takes better care of their pets, the veterinary practice is still going to come out financially fine. Some people have said, well, what about those high maintenance clients that are going to be in every other day because of their free exams? No doubt there are some clients that are going to be like that. But the people who have instigated these plans in their practices say that those clients are, number one, there aren't that many of those clients, and number two, they're more than offset by the pet owners who buy this full bucket of services pay for it and never use all of the services. So wellness plans, I got completely sidetracked there. So it's obvious that one of the features of these routine care plans that's so attractive to clients has to do with the fact that they can bring in their pets at no cost at any time. That brings us back to this whole concept of lower exam fees. I certainly wouldn't recommend to a practice that you go out and reduce your exam fees by some amount. What I think we do have to be looking at, though, is how much we continue to be increasing exam fees. Exam fees are a barrier to entry. Clients know that they are going to have to pay X amount of dollars every time they visit the veterinary practice, even if they don't treat their pet. What we want is to get people in our doors, and if we can keep that initial fee at a reasonable level, at least they visit the practice, we have an opportunity to help them provide better care for their pet, and we have an opportunity to bond them to this practice as well. Another thing that we can consider are premium prices at peak times, lower prices during slower times. We already do this with dental month. February tends to be a slow month for most veterinary practices. Many practices offer some kind of discounts on dental care during that time. We can extend that. Some practices do this with their senior citizen discounts. So senior citizens get a 10% or some other kind of discount if they come between 2 and 4 in the afternoon when the practice is less busy, but we're not giving those discounts between 4 and 6, which is peak traffic time. I don't think there is one single strategy that is right for every practice. Practices have to look at how well they're doing financially, what their pet traffic looks like, what their client traffic looks like, and say, what's the behavior I'm trying to encourage? And pricing strategies are one way of encouraging that behavior. Very interesting slide here. This was provided by Banfield. It shows the number of patient visits, or the increase, the growth in patient visits at Banfield practices versus non-Banfield practices. And as you can see here, there's a much higher growth rate in patient visits at Banfield practices, even during the recession, than at the average non-Banfield practice. Banfield will tell you that it's not just wellness plans that they think is driving this, but they do think wellness plans are one component. They actually attribute their very significant growth during the last couple of years to 3 factors. One is convenience. They're open at better times, so nights, weekends, and holidays. They've also have more veterinarians working for them, so there are more practices, more availability of appointments, and they've been promoting the wellness plans, which have been very well perceived by pet owners. Communication of value is also important. One of the statements that pet owners were asked to respond to in this survey was, "My veterinarian communicates with me using language I understand." And 57% of pet owners said they completely agreed with that statement. Now, in market research terms, that 57% agreement is a very high number. But what that is also telling us is that there are 43% of pet owners who don't get it when we talk to them. So we are asking them to provide better care for their pets. We're asking them to pay more money to the veterinary practice, and yet almost half of them really don't understand what it is we want them to do. Another similar phrase was, "My veterinarian clearly explains when I should bring my pet in for various procedures or tests." Only 44% of pet owners completely agreed with that statement. Another 56% of pet owners did not agree, or did not completely agree with that statement. So over half of pet owners, again, these are people we are asking to provide better care for their pets. We are asking them to pay, in some cases, significant sums of money, and we don't even clearly communicate to them what their pet needs and when. So clearly, for all of the efforts that we've engaged in trying to communicate value, we have a ways to go. One of the areas that was very significant is the physical exam, and we mentioned this earlier, but one of the simplest things that we can do is describe those physical exams as we perform them. So I'm listening to Fluffy's heart, the heart rate is normal, I don't hear any murmurs, I don't feel any lumps and bumps as I ran my hands over Fluffy's legs. You can talk about the eyes, the ears, the skin, the coat, all of those body systems that as veterinarians we look at every time we examine a pet, but we need to communicate that. And that's one of those things, if you look at 20 pets a day, that can become very boring, but it's one of the most significant things that we need to do for clients to understand the value of what we provide. It's also important to remember that we need to communicate value in non-medical ways as well. I think it's also important to differentiate communication, because we've talked a lot about communication here. Part of communication is about the need for particular kinds of medical care or veterinary care. Another component of the communication is communicating value, and they're two different things. Communicating value through non-medical ways isn't enough. We still have to very specifically communicate to pet owners what kind of care they need. But a part of communicating value is through all of the ways that clients judge their visit to a veterinary practice. There's a very interesting article in the Harvard Business Review about the Mayo Clinic. The Mayo Clinic is probably the strongest brand in human medicine, and yet that's a company that spends very little on formal marketing or formal advertising. And one of the phrases in this article, it said, when a company's offerings are hard to judge, customers look for subtle indicators of quality. And that is equally true in veterinary medicine as it is in human medicine. And in fact, if you read this article, I thought it was hilarious, because the same kinds of things that we talk about in communicating value in veterinary practices are exactly what they talk about. So they talk about the fact that the receptionists need to be friendly, and the waiting room needs to be comfortable, and the doctor's lab coats need to not be splattered in blood. What is critical to realize here is that most clients, most pet owners, or most patients in the human field can't judge the medical quality of what's done to them or done for them. They don't judge the quality of medicine, they judge service. And so they're looking at all of those little things to make a determination about whether or not a practice practices good medicine. That doesn't make sense, certainly. Just because a waiting room is dirty doesn't mean that the practice offers bad medicine. Clients can't judge medicine, so they look at these other types of parameters. Payment options also make a difference. We talked about the fact that there's three components to pricing. One is the absolute dollars, the second is the value communicated, and the third has to do with financing options. There was a 2006 study done by Veterinary Pet Insurance, and they looked at their policyholders and compared how their policyholders acted against non-policyholders. And what they found is that policyholders had a 41% higher stop treatment level than non-policyholders. They scheduled 40% more veterinary visits, and they spent twice as much on veterinary care over the life of their pets compared to people who did not have insurance policies. Care Credit did a similar survey of their cardholders, and they found that 71% of their cardholders said that having a financing option available impacted their decisions regarding the kind of care and the level of care that they could offer their pets. So very clearly, having access to funds is critical to providing good quality veterinary care. It's very important as veterinary practices that we understand the financial options that are available and that we educate clients about those. Financial option recommendations are no different from any other recommendation we make to clients. I mean, there are things in every practice that the practice gives advice, recommendations to clients about that the practice doesn't actually sell. So that may be obedience training, it may be grooming, it may be boarding, it may be food that the practice doesn't carry. The concept of offering recommendations about financial services is really no different. It's a product or a service that offers value to the pet owner and the pet. We don't carry it, but we know something about it, and we make a recommendation to clients. In general, clients want brands. They don't want to just be told that you need to have pet insurance or third-party financing. They want to know who you trust, who you're comfortable with, and who you recommend.